Welcome everybody to Go Local Live. I'm Josh Fenton, CEO and co-founder. A couple quick updates. First, if you haven't seen the story today on Go Local, please take a look at it, the amount of data we're not getting and what the potential adverse impact that non-data collection is going to have on restarting the economy and also on our ability to deal with this as a health crisis. I think it's an important piece. Dr. Fine's comments, as well as the Department of Health's response, are in that story accordingly. Also take a look at this afternoon at 2:30. Governor Raimondo will have her press event. Again, she's continuing not allowing the public to hear reporters' questions and follow-ups. That is being sanitized out of her press events, unfortunately. Let's go to Dr. Fine. Dr. Fine, how are you today?
I'm fine. Good afternoon. Nice to talk to you and nice to be here.
Great. Let's go to the numbers. Obviously, the numbers are hitting lots of milestones around the country, and let's run through those.
2 million tested cases around the world, probably 1/100th of the real number, increasing about 70,000 a day. That's pretty stable. U.S. cases now 615,000. Increasing 26 or 27,000 a day, also pretty stable. The good news that while it's way too many cases, it's not an explosion, it's a progression. 129,000 deaths around the world. That's a real number, not a function of how much testing we're doing, growing by about 7,000 cases over the last day or two. Also stable growth. U.S. deaths up to 26,000, more than 2,500 in the last 24 hours. A one-day change doesn't convince me one way or the other, but a stable change still, as far as I'm concerned. Rhode Island, we're at 3,251 cases, 7 new deaths, 265 new positives. Probably will see a drop in that today because of less testing yesterday. The good news is, though our hospital numbers were up some, our ICU numbers stayed stable yesterday. That's very good news. The one thing that's troubling me is that I'm seeing rapid growth in Central Falls, where I pay most attention. Those numbers more than doubled in 4 days. That probably has to do with increased testing. And then the numbers in Pawtucket continue to increase as well. Again, we're not getting day-over-day reporting, so I don't have as good a feel for how those numbers are changing.
Yeah, in that story this morning, we talk a lot about some of the frailties of the state's ability to collect numbers and to report numbers on a timely basis. Look to the north. In Massachusetts, they're going to cross over 1,000 deaths today. Now, Massachusetts has 6.2 larger population than Rhode Island, but that 1,000 number is showing that they are starting to pick up some significant pace in the number of deaths. Is that we're a week or two behind Massachusetts, or are we doing something better than Massachusetts?
Can't tell yet. We're doing well, though. The surge is coming, and I think we all know that. But for the moment, we've been doing exceptionally well, at least in terms of deaths, hospitalizations, and ICUs. The folks in the ICUs are getting busy. The other good piece of information from my perspective is it looks like the alternative care centers are close to opening. It looks like they're doing some work to staff them up. And that, to me, is our ticket out of this. When we get those sites up and have them used for the isolation of people who are sick, I think that's our best shot at really keeping this thing under control, given the amazing and successful work we've done so far.
In California, Governor Gavin Newsom has announced that when the state reopens, he has not set a date, he's going to be looking for a number of significant changes. Waiters and waitresses wearing masks, spreading out of tables in restaurants, everyone wearing gloves, disposable menus, in schools, varying the times of arrivals, reorganizing classrooms to spread students apart from one another. No large group, sporting events, concerts, any of those things for the foreseeable future. If that's 2 months away, is that viable? If that's 3 months away, is that viable?
Well, the problem is I don't think we have good science that helps us understand which particular intervention matters. And so, we try, I think what we're going to do is try stuff and see what happens. And fortunately or unfortunately, we have a kind of immediate feedback loop, a 3-week feedback loop. That 3 weeks after you do X, if you get a spike in hospitalizations and ICUs and unfortunately deaths, then you know that what you did was too aggressive. And if you don't see that, then you're okay. You got to watch these numbers, and I hope that we, as we go forward, are watching serologic surveying as well, so we have a sense of where we are vis-a-vis the immunity of the population.
So should we be smarter than saying we're going to open businesses and daycares and schools and maybe only open one of those at a month period of time, see if there's an impact from it, and then take a next step?
Again, I don't think there's science here. I think different states will try it different ways. We have 50 natural experiments we can try, and we're going to have to sort of feel our way forward, everybody making their best guess for their environment and seeing what happens. I think we have some real challenges around keeping factories open. Again, I keep hearing that people are getting sick in factories. And, I don't know if we're really ready to have them still open, understanding the importance of keeping the economy open in terms of disease transmission. It's and if we have them open at all, we need to have them incredibly well policed, at least in the short term.
Boston University sent out a message on Tuesday that they are looking for a January opening in all likelihood, rather than a September opening. That's the first college or university in the United States to make such a pronouncement. Is that the smart move, and do you think other colleges and universities will follow?
Well, it may be smart for Massachusetts. We don't know yet whether it's smart for Rhode Island. Again, we have to see our dynamics. I think it's always wiser to plan far ahead, and you can pull that change back if you find that you don't need it, but why not do it? If you'll recall, early on, I misunderstood something that came from the governor's office, and I thought we had closed restaurants till the end of May. I think that's probably going to be a real thing. So looking that far forward makes sense to me.
For Harvard researchers published yesterday in Science, a leading research publication, that they see social distancing being necessary intermittently all the way through 2022. The other part of the story, which a lot of the press did not pick up on, was that they really foresee this as a run rate all the way through 2024. Your comments on their research?
Projections are projections, and they're based on assumptions. And you test assumptions in the real world. So, I think we kind of have to go month by month, day by day, and see what the numbers tell us. I don't see how you can make reasonable projections till we have a sense of what the immunity is in the community. I think you've got to make best guesses around when a vaccine is available. And those are just wild guesses right at the moment. And then you have to make guesses around how we go about making sure the population gets immunized once we get the vaccine. Remember, we're a country without a healthcare system. So we don't have any coherent way to make sure every single person in the country is vaccinated. Before I'd be worried about those projections, I'd start to think about what it would take to build a healthcare system. I've been very impressed by work that's being done by an old friend in New York, where, working with the governor, they're trying to create a single hospital system for the state. I think that's what we all should be working on, and creating a healthcare system that you've heard me say this 1,000 times, provides primary care to all Americans, if for no other reason than because that's a way we can reach all Americans when we get that vaccine.
Some of the hopeful, the hydros and the others are proving after some levels of testing not to be solutions.
Well, again, the science is going to take us some time. And, I'm seeing studies this way, seeing studies that way, seeing recommendations this way. I saw a set of recommendations that came out from an expert panel, but the expert panel met on March 17th or 18th or 19th. So by now, those recommendations are all old hat.
Yeah.
This is, people are inventing solutions as they go. 3 weeks ago, 2 weeks ago, a week ago, my colleagues in the ICU were saying you needed to intubate people early as soon as they got into respiratory trouble. Now there's beginning to be some thinking about holding off on intubation and respirators and trying to use prone positioning. Again, until we have good science, these are expert opinions and those are valuable, but science is what's going to matter in steering us out of this at the end of the day.
Is anybody doing that at least national collection of data? Almost 27,000 Americans dead, over 600,000 cases tested positive. Who is collecting that data from a macro sense, checking in with hospitals that have seen hundreds and thousands of cases in hotspots like New York, New Orleans, Chicago, et cetera, and starting to build some learnings from that data?
We're building this airplane as we're flying it. That's pretty clear. So there are people who, and should be, doing everything they can on the front lines, taking care of people. That's got to come first. Patient care comes first, always, always, always. And then there are researchers and other people who do both research and clinical care or constructing studies as they go. I've heard that there's a move to start organizing the hospitalization data nationally, but that's just starting. It's gonna take 3 months at least, I think, before we have some coherence. And I think the thing that is really painful, as I see it, this is something that's 30 years late, is that we have no real national consensus or national leadership about what a healthcare system should look like, what services everyone needs, what data we need, how we create an inflow of data from around the country. What almost no Americans understand is that the only population-based data we have in the United States is birth certificates and death certificates. Almost everything we have is survey data. And survey data is helpful, but it's not precise. In this time in history, with this level of sophistication of our information processing, we should be light years beyond that. And my challenge to us all is to figure out how we could create a social and political consensus to build a healthcare system that takes care of everyone and does this in a coherent way instead of a disconnected, disarticulated, chaotic way that focuses on profit, not on best public health outcomes.
Dr. Fine, what else should Rhode Islanders know today?
Well, watch for more and more evidence of the disease among families and friends. It's out there. It's happening more. This is the moment to be reaching out to people, help making sure they have what they need, making sure anybody who's sick doesn't have to go out of the house to get food, that we bring food to them. And then the moment that the alternative care centers open, let's all work together to get everyone who's sick into isolation until they recover. For me, that's the pathway out.
Dr. Michael Fine, thank you as always. Incredibly helpful and incredibly valuable, and at the cutting edge of this entire crisis in Rhode Island and America's healthcare system. For everyone else, back at 2:30, Governor Gina Raimondo, and stay tuned for more news throughout the day. Every time we think there's going to be a lull in the amount of important information, it seems to shift into another level of hyperspeed. Stay tuned, we'll have it. Thanks so much for joining us.
Thanks, Josh.